At HCG Cancer Centre, they have these social workers where they had it explained to me that you'll be doing the process. And one of the things that I liked about there was about, you know, when from the receptionist, the way they receive you, even with their smiles. And then you go to the nurses, from there to the radiotherapy team. You know, like they tell you, people have gone through this, through here, and they're okay.
And they've recovered. Because we're on the cancer series, I'm dealing with what? A cancer survivor, a cancer warrior. And her name is Sister Ann. Sister Ann.
Sister Ann Gathegu.
Ann Gathegu.
Missionary Sisters of the Holy Rosary.
Missionary Sisters of the Holy Rosary.
We're missionaries and we're international.
You're all over the world, everywhere.
Yes.
So you're part of it in Kenya?
Yes, I'm here in Kenya.
Wapi? The Nini itself, is it a parish? I'm not a Catholic. I don't know the terms.
My community, or people call it convent. I'm in Parklands.
Convent. Parklands.
Yes. But our congregation is international. We are in Africa, we're in Europe. Oh. And we were founded 1924.
1924?
Yes. And we're also looking, as we continue to evangelize, we do evangelization, you know, preaching the good news to the poor, and we do this through the ministries
of the poor. The rich, we don't need good news.
But we do this through the Ministry of Education.
Oh, education.
Yes, we do it through health, pastoral work.
When did you join the parish?
Congregation.
The congregation?
Yes.
Not the convent?
No, I joined 2006.
2006.
It's a good experience. So we're also looking for more young women to join us.
Yes. Okay, that's nice. That's nice. Nice to meet you. One day you'll come tell us about all that, convent and sisterhood. It's something very interesting to me, actually. From
first encounter with a sister?
No. I've met sisters as patients, as friends. I don't have any close friends who are sisters. No, I actually do. A colleague of mine from med school was a sister. Where we are not that very close. Okay. But anyway, nice to meet you.
Will join us through this.
Yeah, nice to meet you. So the reason today we were on Daktari A Quick One, medics mainly, but the reason you are here with us today is because, Maze, you beat it. You were diagnosed with cancer.
Breast cancer.
Breast cancer of the breast. How long ago was this?
This was 2004.
2004.
Yes, but myself, I just walked into the hospital.
You weren't sick?
I wasn't sick. I didn't even have the signs and symptoms of breast cancer. As I said, our congregation, we are missionaries and international. I was working in Sierra Leone. So I came home for my holidays. So preparing to go back, I decided, let me just go for a wellness checkup to know if I'm okay and just to, in case of anything. So I walked in. And after everything, I got the results. Everything is okay except there's a lump on my left breast. Oh,
so the wellness included a mammogram. They did a mammogram?
Yes, yeah.
Okay. Do you mind telling us which hospital this was?
This is MP Shah Hospital.
You went to MP Shah?
Yeah.
And they found a lump?
Yes.
This is back in 2004?
Yes. It was 9th of January.
9th of January 2000. Yeah. So a wellness check. And how old were you, if you don't mind?
45 years.
From there, wellness check, you're not sick, you're told there's a lump. How did it feel, Kwanza, before you tell us what happened?
My world crashed.
Hey, well, can you a lump? You panicked? I
was like, what is, you know, that my mind just started
thinking.
What you know, the mind is inclined to that negativity thinking. So when I got the results, I was sent to the breast specialist. I went to
immediately.
You know, when they saw
the lamp, they told you
it's better to move to see a breast specialist, which I did, thanks to Dr. Karen Babu.
Oh, that's your doctor?
Yes. She's not only a doctor, but a beautiful woman with a beautiful heart, a breast specialist. So she looked at me and looked at the results, and she advised I should do more tests, which I did
immediately.
But I went for second, third opinion.
Oh, which is very important in
I
medicine.
went and they still say I had a lump. So when the second hospital I went, actually, the doctor still referred me to her.
Sent you back?
Sent me back to Dr. Karen. So I came back and I told her, I went for this, but I've come now. So I did the biopsy.
Still in MP Shah?
Yes. Everything I was doing with Dr. Karen here at MP Shah.
Ah, okay.
That's what I'm saying. It's a good hospital. Dr. Karen is a good doctor.
So shout out to Dr. Karen.
Yeah. Bravo to her. So after that, did the biopsy. I had now to go and then do immunohistology.
Yeah.
I did all those. It took like 1 month.
From the time the lump was found to the time you have your immunohistochemistry results.
On the 14th of February, it was a very important day in my faith.
Hiyo ni Valentine.
It was a Ash Wednesday. As a Catholic, yes. So my journey to begin the Lenten season was the breaking of that news that indeed the lump is cancerous, and I was diagnosed with invasive ductal carcinoma. So my world crashed. I didn't know what to do with myself. I cried. But lucky enough, I was with one of my relations who was with me. Like she took me to the hospital. That's the cousin.
Oh, your cousin.
And then, to make the matter worse, as she said, but the doctor did very well, She brought me closer to her, looked at me direct to my eyes and said, "How are you?" And I said, "I'm anxious." And she was like, "Yes. According to this result, it shows you have breast cancer."
Had you read the results before, or the doctor had the result and you just walked in?
When the results came, you receive the results, then you take them to the doctor.
So you had read?
I had read, but it wasn't, your denial. So it's like, what did you say? I kept quiet. Then as Daktari umesema, according to this result, she repeated, it shows you have breast cancer. Wow. I cried, my world crashed. And after crying, life had to move on. She now gave me the treatment plan. When I was calm, she gave me the treatment plan.
At the same sitting?
Yes.
So she told you now you have invasive ductal carcinoma.
But the good thing was like, Anne, you are crying. She told me, Anne, you are crying. But for me, it's good news. I'm like, how? You
can't see where the good news is. What is good about cancer?
What's good about this cancer? It's good news because it's early detection.
We always say, actually, any cancer detected early is 100% curable. You find it early, you treat it. You're like, oh, wow.
But that time it was not making sense.
But for the patient, the word is cancer. Hear that and
it was like, but the good news is that it's early detection. So I was looking at her and she was like, my treatment plan was...
So she gave you a treatment plan?
Yes. She was just explaining as if nothing is happening. So surgery, after surgery, I had to do 20 sessions of therapy.
20?
Yes, and then hormonal therapy. But at this time, my mind is going, where is this treatment going to happen? When you hear about cancer, you start just thinking...
India.
So, but she just told me, I'll do this, and then I'm going to send you to an oncologist. And then I was sent to the same oncologist.
Just next to him.
Just next to him. I think it's a good plan.
Very.
So I went there and met an oncologist, Dr.
I like how you're happy about your doctor. I like the smile you say you have when you mention your doctors.
Because they have journeyed with me. They did not just give me treatment, the prescribed treatment. They journeyed.
They didn't treat you like just any other patient.
And I believe that's how they treat their patients. Because from my experience, I also refer people to them. So I met Dr. Oncologist, Dr. Helena Musau, and she looked at my results after the surgery. There's those results you said.
The biopsy again, it has to be confirmed.
And she looked and said, this is, it's just we can't see with the eyes, but this is good. the results shows this is good result, you're okay. Then there was another kind of consolation.
So she said the surgery was exhaustive. We have clear margins.
Yes. So
the lymph nodes are clear, things like that.
No, your doctor, you're calling them by name.
Yeah.
So, and at the end of the day, she told me you'll have 20 sessions of radiotherapy.
Okay.
So I did the one I did it's called VMAT. Volumetric modulated arc therapy.
Okay.
Now you can ask whatever.
The radio guys.
Yes, you can ask them. But I remember very well because when the social worker at HCG Cancer Centre was explaining to me, he explained to me why they have to use they have to use that one because they offer 5 different types of those radios. But mine was specifically that because it was already localized to the type of the cancer and all that. And after 6 weeks, now I started the radiotherapy sessions.
After 6 weeks
of
from
surgery.
After the surgery, now 6 weeks you started the radio.
Yes. So,
and the surgery, was it both breasts or one?
It's left breast. And I did lumpectomy.
Lumpectomy?
Yes.
Lumpectomy?
Yes.
Like it was that early?
Yes. You know what? I tell people, you may be like me walking up and down. You think you're okay. And you are not okay. You'll be having something within your body and you don't know. Because I was just walking and thinking I was okay. Here I was carrying a cancerous tumor.
And you had no idea?
I had no idea.
Had you ever, by any chance, because we encourage women actually to do self-breast examination, had you at any point done a self-breast examination and felt a lump before you go? I was
not keen about that. Now I tell women, after your menses 7 days, 8 days, kindly, I talk out of experience, kindly make sure you do your physical examination.
So you did a lumpectomy, started radio within 6 weeks?
Yes. And then
how many sessions?
20.
20. And you did all the, how was the duration for that? Like, were you doing a weekly? Was it
Monday to Friday, you rest Saturday, Sunday.
Oh, you do every day?
So it's 1 month.
Or 1 month?
Yes.
20 sessions.
But before this, at HCG Cancer Centre, they have these social workers where they had it explained to me that you'll be doing the process. And one of the things that I liked about there was about when from the receptionist, the way they receive you, even with their smiles. And then you go to the nurses, from there to the radiotherapy team. Like they tell you, people have gone through this, through here, and they're okay.
And they've recovered.
But during that, on the 8th day, the side effects started.
Yeah, I was about to ask that, because that is usually the big fear when we hear chemotherapy. In fact, I have a relative of mine. I had like, as a doctor, I saw some of the symptoms, like, we need to investigate this mzee, and he was eventually found to have a type of cancer, had prostate cancer. But then, as a family, we decided he's a mzee, we're not going to go through chemo because of the side effects, Yeah, so how is it for you? Were there any,
The side effects were there, and some of them were tough. I could not chew and swallow for 2 weeks and 5 days.
Really? Couldn't chew or swallow?
I could not chew and swallow, so it has to be something soup, blended very
blended
small.
Diet.
Then they changed the itching. I couldn't wear some even clothes like normal clothes. I had sometimes to use something like shower.
This is from radiotherapy?
Yes, because the skin, itches, it's peeling. You'll be thinking it's like umechomwa. And I know when you go for that radiotherapy, the radiotherapy team, they were very good. They will explain, you're just lying there, the radiation beam will just be there. No, I don't, just looking.
That's how they say it.
Yes, that's whatever was happening.
After it, in a trauma.
From the 8th day, then until I finished, the journey was like, after a week, I'll see my Daktari.
Oh, after a week you consult the doctor and a review.
I tell her the side effects. I was given the medications and all that.
Creams and stuff.
And then when you're very low, then you meet with those social workers. And it's in that process, being there at HCG Cancer Centre, I was connected. Actually, my surgeon, Dr. Karen Bab, sent me to Faraja Cancer Support Trust.
I've just actually spoken to the CEO. You can see, come on, watch the whole thing. You can see the CEO's interview, and that's the thing. He mentioned very good support system from Faraja. And how did they come in for you as Faraja?
The complementary therapies that they go all there. You know, like they don't tell you to abandon your treatment, but they go hand in hand. And then the support group. Like I belong to breast cancer support group.
Oh, okay.
So we have our meetings every last Tuesday of the month or something like that. And with that, I was able to meet people who have gone through this journey.
Other people
and
who've come even before you.
And I was like, ikitu ni kawaida hata tushapona sisi wote. My
Zumba.
best is Zumba dance, chair yoga. There's something else we call breathing exercises.
What do you do in breathing exercise?
Okay, it's like chair yoga or the yogas. There's some exercise you do and you're breathing in and out.
So you focus on your breath.
Yeah, you focus on your breath and your
sort of a meditation sort of thing.
No, like think air. We breathe just naturally. I think that air is it's healing, by the way.
It is.
It is healing. They also enjoyed their massage.
Massages.
Reflexology.
Really? Hata unaweza sema ni waendeleange tu kukuja.
No, you come. This thing is open.
It's open?
It's open that Mondays, the program is there. So anybody who is available, you join. But things to do like maybe massage, you have to book. There's something also we call MSTR. Yes, muscle scar tissue release, something like that.
Oh, for the physiotherapists, right?
So now, that is using it just it's a machine. That's a machine by use of hand. There's the specialist or the professional in that. She does. If you are tight, you after the surgery, you feel that your body, whatever is tight. There's the way she uses her hands.
Yeah, I've seen that. I've seen patients who've undergone mastectomy, and I remember a particular patient, and she couldn't even move her hand at all because we had removed this entire, and she couldn't. And
there's that therapy that is use of the hand. There's the way she does it, and then very soft, and it helps to release whatever it is, the tissues, and you are good to go.
Interesting.
So all these
is accessible at the HCG
at free of cost.
It's free.
At free of cost.
You know, he mentioned that there is a fund, but I forgot to ask him if for these complementary things there is a payment. There isn't.
There's no payment.
You just walk in and
yes, you walk
yoga and physio, all that.
Yes, and
the support group.
And the support
all
group,
free.
All free of cost.
Amazing.
So it complements. Sometimes healing is not just physical.
It's not just the cancer.
It's physical. The healing of the pain.
Yeah,
the
we usually say
the social part of it. Yeah, the psychological part of it.
We usually define health as not just merely the absence of disease, but it's a complete wellness of the person. So I might treat your breast cancer and it goes away, but the chemo, the radio, they're affecting your finances, you're affected. Socially, you're not well. So I think they're doing a very good job at Faraja. So what stage are you in your journey?
My stage at this point,
you mentioned hormonal therapy.
I'm doing my hormonal therapy. But the good thing is after the 6 weeks, after I finish my radio,
the 20 session?
Yes. After 6 weeks, after 6 months, I did my first test, medical review. Nothing was in my body. So me, I'm okay.
You're cancer free.
I am okay.
High five. Up top.
And I believe, for me, as a Christian, God was in it. The divine intervention was real.
That decision to just go do that well.
I believe it was divine intervention. And having journeyed with me, and as I did a lot of as a Christian, as a sister, you know, we do a lot of prayers, networking, people praying for you and all that. So, and God was in it, because I believe after that, it did just come. It did not just come and leave me like that. This kind of something happened. That painful experience. Have a new meaning and purpose in life. I find a lot of purpose when I journey with other cancer patients.
Oh, okay. You help them with the support groups and stuff.
And like even one-on-one, like I get calls from people. I have this patient, and I go talk to, you know, just giving people, because I've gone through it. So I tell them, you're also going to go through it.
You'll be fine. And
at the end of the day, like Fridays, I volunteer to be at Kenyatta National Hospital when I have time. To be with children with cancer.
The cancer wards.
I volunteer through Faraja, by the way.
Through Faraja?
Yes, so I find purpose in that. And when I'm overwhelmed, you know where to go back. There are all these complementary therapies. You have a place to call home. Like one of the ones I said, dancing. That breathing I was actually saying, transformational breathing. It actually transforms you. It does. I think it's something, the way you describe it, I think it's something that you don't even have to have cancer. You can just come and do it. But now, you know, those exercises, they are good for everyone. But now you miss cancer. Faraja is there for cancer patients, survivors, and caregivers. You understand? Okay. But it's something that after you are overwhelmed, I can always go back there for. Amazing, amazing. And at the end of the day, cancer is not a death sentence. It is not. When you are told that you have cancer, one feels like, I've not done so much, I need to do. People start, they start rushing life. Yes, please, anyone who is being diagnosed with cancer at this point, don't rush about life. Be calm, because those things you will never even finish. You not even finish. So just know that being diagnosed is not a death sentence. Don't rush life. One day at a time. One day at a time. And every morning, what also gives me like self-talk. I tell myself good things. I sing a song for myself. I'm so glad every little cell in my body is happy and well, because the body responds with the frequency which you talk to it. So, and always support with mental health. You always look for someone to journey with. Yeah. So that's my story. Amazing. Very long, but cut into short. Thank you very much, Sister Ann, for that amazing, insightful, inspiring, motivational story of yours. Thanks for sharing it. It is not easy to just be ready to open up about your journey, but you are doing it. And I know you encourage not just people who are battling cancer, even us medics, because sometimes some of us might think there is no hope. Evidently, there is a lot of hope. So from Daktari A Quick One, it's been amazing. Thank you, Sister Ann, for gracing us. And we hope to do this and more, many more in the future. Adios.